Ayan guys, welcome to my vlog. So today guys, wala masyadong ganap sa buhay ko. So napag-isipan ko na gumawa ng isang health education content about diabetes mellitus, hyperthyroidism, Cushing syndrome, liver cirrhosis, polycystic colitis, and cholelithiasis. So, para mas maintindihan ng lahat kung ano ang mga sakit na ito, I will give important details about these diseases. So, let's start with the diabetes mellitus. Diabetes mellitus is a disorder in which the body does not produce enough or responds normally to insulin, causing blood glucose level to be abnormally high. There is two types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes, also known as the juvenile diabetes or insulin-dependent diabetes. This is a chronic condition in which the pancreas does not produce insulin. Insulin is a hormone needed to allow sugar to enter the cells to produce energy. This is a autoimmune type of disease. Once we say an autoimmune type of disease, this is a condition in which your immune system mistakenly attacks your body. The second type is the type 2 diabetes. Type 2 diabetes used to be known as an adult onset diabetes. It is an impairment in the way the body regulates and uses sugar as a fuel. This is a long-term condition in a result. As a result of that, there is too much sugar circulating in the bloodstream. Eventually, high blood sugar levels can lead to disorder of the circulatory, nervous, and immune system. The pancreas does not produce enough insulin. Insulin, this is a hormone that regulates the movement of the sugar into the cell. The cell responds poorly to the insulin and take it less sugar. Next is the hypothyroidism. Hypothyroidism, also known as the underactive thyroid. It is a condition in which your thyroid gland does not produce enough T3 and there is an elevated T4 in your body. So this is a autoimmune type of disease as well. So next is the Cushing syndrome. Cushing syndrome occurs when your body is exposed to high levels of hormone cortisol for a long time. So Cushing syndrome, sometimes called hypercortisolism. Maybe the cause of this is an oral corticosteroid medication, too much use. The condition can also occur when your body makes too much cortisol on its own. So, ayan guys. Next is the liver cirrhosis. Liver cirrhosis is the end stage of scarring or the fibrosis. This is the end stage. So, liver cirrhosis caused by many forms of liver diseases and conditions such as hepatitis, chronic alcoholism, and chronic alcoholism. Each time your liver is injured, whether by diseases, excessive alcohol consumption, or another causes, it tries to repair itself. That's the cause of the scarring or the fibrosis. So when that happens, always your liver will try to repair itself, causing the scarring or the fibrosis of your liver, and eventually the late stage, it will cause the cirrhosis, and that's the end stage of the liver fibrosis. For non-alcoholic, it's called non-alcoholic fatty liver disease. Cholecystitis. Cholecystitis is the inflammation of the gallbladder. Most often, the cholecystitis is a result of hard particles that can develop in your gallbladder, also known as the gallstones. Gallstones can block the tube. The tube is called the cystic duct, through which the bile flows when it leaves the gallbladder. The bile builds up, causing the inflammation. So that's the causes of the cholecystitis. Next is the cholelithiasis. It is also the formation of the gallstone. The cause of cholelithiasis is not completely understood, but it is thought to have multiple factors. The gallbladder stores bile and releases it into the small intestine when it's needed for digestion. Gallstone can develop if the bile contains too much of cholesterol or too much bilirubin, or the gallbladder is dysfunctional and cannot release the bile. Different types of gallstone form is cholelithiasis. The most common type is called the cholesterol stone. It is a result from the presence of too much cholesterol in the bile. Another type of stone is called the pigment stone. It is formed by causes of excess bilirubin, a waste product created by the breakdown of the red blood cells in the liver. The size and number of the gallstones varies in the cholelithiasis. The gallbladder can be formed many small stones or one large stones. So, ayan guys, I hope this vlog of mine will help you to understand about these diseases and will aid you from your knowledge. There is a lot of video after this one, and I hope this video will also supplement your knowledge. And ayan guys, thank you for listening, and please like and subscribe and click the notification bell for more updates. Thank you! Love.
Here's the disease that we got. The Amerkhan crushing at lagnat if we'll not take good care of ourselves and don't do exercise too. Those are the ones here today. Those are the ones that were lost in a way. The disease is not good in our life. The disease will bring you to the end life too. There's a time that I remember when I did not know the end. I eat a lot of carbohydrates, smoking, drinking, and gain weight. Now my blood is getting thicker, viscous, sluggish, all the same. And insulin is lacking too. Now I don't know what to say, yay. Lifestyle hurts sometimes, or lifestyle hurts someday, ay. But everything will be alright if you call your doctor right away. Here's the disease that you got. Tell me the signs and symptoms that you have, cause it seems you have an infection. What you have: frequent urination, numbness, tingling sensation, slow healing source, fatigue, and weight loss. You're suspected for diabetes. Oh, increased thirst, hunger, blurred pa ang vision mo. Increased thirst, hunger, blurred pa ang vision mo. And that's what I have remember about Cushing's syndrome. Buffalo hump, moon face, excessive hair, high cortisol hormone, substance activity, the cause of this disease. You should take calcium and vitamin D, blood test and urine test, yay. Adrenal ectomy for the surgery, methadone medication and radiation therapy. Here's the disease that we got. Tell me the signs and symptoms that you have. If you have slow movement and thoughts, and you have low pitch and hoarse voice, goiter, tingling sensation, tiredness, your skin, pati na depression. You're suspected for hypothyroid o decreased thyroxine T3 sa body mo. Ooh, 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 ooh. Do 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 do. Decreased thyroxine T3 sa body mo. Do 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 do. Decreased thyroxine T3 sa body mo. Araw-araw, barkadang gusto kong kasama. Buhay ko'y kompleto na. tuwing may inuman pa. Katabi ko ang kaldereta, di pa rin ako makapaniwala na ang di ko pinangarap na sakit ay nandito na. Sakit sa atay ang problema ko, at basta't nandito na, magbilang na ng oras. Dahil dito ako'y matamlay, mga balat ko'y dilaw ang kulay, mga paa ko'y namamaga, nangangati pa nga. Nagkakain ko laging susuka, pagkain ko'y wala pang lasa. Dahil dito nawawalan lagi ako ng gana. Gawin ko ang lahat para lang gagaling na, pero liver cirrhosis, wala nang pag-asa. Minuto, chine-check AST ko, pati na RBC ko. Kung may infection ba ako, wag mo muna kong kausapin. Sakit sa tagiliran aking feeling, walang magagawa dahil nandito na. Bato sa apdo ang impormasyon, cholecystitis siya, pato'y bumara pa. Dahil dito ako'y matamlay, mga balat ko'y dilaw ang kulay, mga paa ko'y namamaga, nangangati pa nga. Dahil dito ako'y matamlay, di ako nang kumain ng gulay. Dahil dito admission ko ay walang katapusan. Gagawin ko ang lahat para lang gagaling na, pero liver cirrhosis, wala nang pag-asa.